watching West Hartford Community Television.
You're watching West Hartford Community Television.
You're watching West Hartford Community Television.
For the community, by the community.
Good day. I am H. Robert Silverstein, MD, for the Preventive Medicine Center, as well as West Hartford Cable Access TV. If you have any questions about this show, you may contact us via the email at info@thepmc.org. Just go to the website, and the way you get there is you Google my name, H. Robert Silverstein, MD. You'll find a link to the website, which is www.thepmc.org. Those letters stand for the Preventive Medicine Center. So that's how you can figure out what it is if you didn't understand that. Okay, today's show is going to last about 2 hours, so settle down and get ready for a lot of information. Let's see here. I have a bunch of information. One of the things on our website, well, let's back up. I've probably shown this before. Not that I really want you to read it, but you can see there are not a lot of words here, and it's pretty big print. And I like to make the joke that I deserve the Nobel Prize for this because it has to do with medicine going in the completely wrong direction. Almost all of medicine says, what's your problem? Here's your prescription. Very, very few people are looking at what people do to make themselves sick. And you may say, well, that's ridiculous. People talk about smoking, people talk about overweight. But the point that I want to make specifically is that if you have high blood pressure, which is curable, if you have diabetes, which is 95% curable, if you have high cholesterol, which is 95% curable, if you have high triglycerides, which is 95% curable. Let's go back to the diabetes. Diabetes is 95% curable. If you are predisposed to cancer of the colon, diverticulitis, gallstones, etc., those things come from what we do. And if we do not do the wrong things for this human biology, then those diseases do not occur. And on this piece of paper, what I say down at the bottom is it's very much like bringing a lighted match to a can of gasoline. If you don't bring them together, there is no problem whatsoever. And that's precisely the point. Those people who are genetically predisposed will not develop those diseases if they don't do what is necessary to cause those diseases. Now, you might say, all right, tell me what to do. I've told this audience about 1,000,000 times what to do. We are living in an herbivore's body. A carnivore meat eater can digest rotten meat. Can you digest rotten meat? So the point of that is, that's the first sign that we are not a carnivore. Second sign is a carnivore's jaw comes down like a pair of scissors. Our jaw comes down like for grinding, like all the other herbivore vegetarian species. Now, by the way, I'm not saying you don't have to do anything I say. This program is an invitation to consider. I don't put out any information you have to do. Very much take it or leave it. And I don't mean in the cold sense of take it or leave it. I mean, you know, you are free to choose. And what I believe I'm trying to do is help you retain your health freedom, to be as youthful and active as you can be, not see doctors, not have co-pays, not pay parking fees at the doctor's office or the hospital, not go into hospital, not have IVs, not have surgery. And if you've had those things, then you need to look back at what you did that provoked that. And I maintain it's what we breathe. We're supposed to breathe clean air. What we drink, we're supposed to drink clean water. Yes, I have some concerns about fluoride and chlorine. Do I want my water to become infected without those things? No. But on the other hand, I think that we need to think carefully about what we're doing. There is information to show that fluoride and chlorine have downsides. As a matter of fact, everything has a downside, even the right things. So if you do too much of the right thing, that turns out to be wrong. But on the other hand, what about the things that we think are okay? What we put in the water, what we put in the air, whether or not we smoke, fireplaces. Now, if you say, well, I use my fireplace twice a year or twice a month. I agree, the body will tolerate things to a certain degree depending upon amount of exposure. And yes, we can tolerate cyanide very little. But on the other hand, we can tolerate fireplace smoke a little bit more. So that's part of the beauty of being a doctor. The best part of being a doctor, or simply for that matter a human being, is judgment. What constitutes proper judgment? And speaking of that, what do you think of our politics? Talk about terrible judgment. My goodness, the way Hillary Clinton handled this pneumonia thing, which, by the way, I think might be pulmonary emboli, which are clots in the lung. Remember, she did have a clot in her brain, and she is on warfarin, a blood thinner, so she may be predisposed to clots. But my goodness, the way she handled this, the deception, the secrecy, that's nothing short of intolerable. And that does not forgive Trump for some of the idiocies that he has done. But on the other hand, you have to judge each individual event on your own. Going on, breathe, drink, eat, exercise. How much should we exercise? I'm not a perfect example of exercise. I did exercise some on a treadmill today. I think I got up to half a mile before I came here, and then do a little more later on. But we're supposed to exercise to the point where we can see the muscles meet the muscles on the tummy. That's what constitutes proper exercise, and that's also what constitutes proper percent body fat. An absence of fat under the skin on the abdomen to the point where you can see the muscles meet the muscles. That's called clear lines of definition and demarcation. Now, what if you have a little bit of fat and you can't quite see them? I am not perfectionistic. I believe that people should do as best they can. But on the other hand, it's sort of like we need to continually strive to do better, and that goes for me. I could do better with my own weight, diet, and exercise, and I've been better in the past, and I've been worse in the past, and had high cholesterol, and had perfectly normal cholesterol, and so on and so on. And thank God I'm as lucky as I am at my age, and so few things have happened. Not that nothing hasn't happened, for which there is the explanation of I provoked it. So once again, that's breathe, drink, eat, exercise, and then the greatest predisposition to anxiety and depression and post-traumatic stress that I can see, and I understand the concept of overwhelming. Overwhelming is simply too much for the human body to bear. The problem is that we think that sort of applies to us, and that's our first mistake. It can happen, but we should not accept that. Unrealistic expectations. I don't know how to make it any clearer than that. Bad things happen in life. Accept and deal with them. I've had plenty of bad things happen in my life, some of which I've made happen myself. And the fact of the matter is, I'm not one of those people that I refer to as an ice skater. They just seem to go like this and skate through life and do things right, and very little to nothing bad happens to them. Well, I've provoked trouble and I've gotten trouble, but you see the key to resilience, the key to not becoming anxious or depressed is accepting that those bad things happen, and your responsibility and my responsibility is simply not to complain about it, but get back up and start dealing with life the way we were supposed to. Now, Diane, what do you think of that? Go ahead. Go ahead.
Oh, you know, you're right on the money.
I'm right on the money, she says. Well, that's 100% of one person who, oh, today I'm so smart. Well, I told you it was going to be a very long meeting today. Anyhow, let's try to get to some other things. We started with okay. Here is okay. Something that I would like to see the public make happen. This is what I call breakthrough technology. If you follow me on Facebook, every now and then I put something there where I say, this is breakthrough technology. And now what I have here is an article on fractional flow reserve. I understand you don't know what it is, but try to remember the initials FFR. If you go to the emergency room, probably the single with complaints of chest pain, whether you have known heart disease or not, probably the single best test is a CT, CAT scan, CT angiogram with fractional flow reserve. Now, does John Dempsey, does St. Francis, does Hartford Hospital have these? I don't know if Yale has this. I don't know if Bay State Medical Center up the street in Springfield has it. But the fact of the matter is, if they don't have it, then the public should see that these institutions get it, because it tells you whether or not you have hardening of the arteries. And what you have to do is you buy this software that can look at the angiogram. They inject X-ray dye. Now, well, you might say, well, I'm allergic to X-ray dye. Fine, we have protocols for dealing with that, but there will be nothing applies to everybody. But this applies to almost everybody. Remember when I said diabetes is 95% curable and preventable, and that high blood pressure is 95% curable and preventable, and cancer of the breast and uterus and colon and prostate and heart attack and stroke and angioplasty and open heart surgery, 95% preventable. So do the things that are right for the human biology, and bad things don't happen. And then, of course, you get down to unrealistic expectations. Accept and deal with reality, and perseverance is everything. It won't reduce one problem, but it will reduce your predisposition to anxiety and depression. Now, so fractional flow reserve should be in every emergency room. It's a software program that is connected to doing a CAT scan, and there isn't a hospital around here that doesn't have CAT scans. So it could be done, I think, virtually everywhere. Now, this is something that I rail about. This is an article. That article, by the way, on fractional flow reserve was from the American Journal of Cardiology. Let's see, just published, 2016. I think it was last month. And the title of it is Effect of Fractional Flow Reserve. And then it has some numbers after that. This is from the New England Journal of Medicine, which is, as a general medical journal, is sort of considered one of the highest general medical journals in the world. And they published an article by Jeff Drazen. I've known that name for a very long time. Also Janet Woodcock. They're the editors. Stuart Pocock is the one who wrote that with Greg Stone, a couple of smart people. And they talk about what's wrong with medical studies. And I can't tell you how poorly done so many medical studies are. And you may say, well, that shakes my confidence in believing what I read and hear about breakthroughs and so on and so on. You need someone who can sift through this and have good judgment. I just saw a patient last week who, a teacher from UConn, and he'd been to a local physician, and I was astounded when the local physician told him that his cholesterol was okay. It was exactly average for a heart attack. Now, the local physician with the great reputation was going to treat his high blood pressure, which was correct, but look, There are rules and numbers out there, and let's see if this is on our website, Keys to the Kingdom. These are the rules if you want to prevent diseases. I was going to go through my emails because I posted a bunch of things so that I could pull them up quickly. Like, for instance, well, let me go through this. This talks about what non-HDL cholesterol you have to prevent a heart attack. That says halfway, right, Diane? Okay, fine. And see, I don't believe in treating a patient to reduce your cholesterol. I want to go to that goal, which essentially stops the progression of hardening of the arteries or reverses it. And that is a non-HDL cholesterol of 90 and triglycerides of 100 and uric acid of 5.5 and BUN, which is a kidney test, of 12 and a magnesium level, which reflects your diet, of 2.1 to 2.4 and a potassium of 4.1 to 4.5, which also reflects diet, and so on and so on. And A1C should be 5.5 at age 55, lower below that age into the 4s, and not above 6.2, sort of no matter how old you are. And you might say, well, where do you start treating? I'm telling you, do the things that I read earlier, and I don't have to treat. No, your doctor doesn't have to treat. Breathe right, drink right, eat right, exercise right, clear lines of definition and demarcation, a 90%, I did not say 100%, vegan, vegetarian diet. I said 90%. And that translates as palm-sized servings of wild-caught fish or free-range chicken or cage-free eggs or bison. So there, I've got fowl, I've got fish, I've got eggs, and I've got meat. But you add all those things up, and if you have clear lines of definition, which 1% may have or less, then you can have that 3 times a week. And if you're pretty close to that, you can have it 2 times a week. But you better make it once every 2 weeks if you're overweight, because those animal proteins stop weight loss. By the way, just FYI, those animal proteins predispose to osteoporosis by creating an acid load, whereas vegetarian protein does not cause an acid load. So what am I talking about? I'm talking about grains, vegetables, beans, fruit, nuts, and seeds. And the grains are quinoa, whole barley, that's like saying whole barley, barley with a hole in it, brown rice, millet, teff, amaranth, buckwheat, not oatmeal, not steel-cut oats, but oat groats. Those are the unprocessed, ideally organic, whole grains that are better for you than brown rice pasta or Ezekiel bread. By the way, I do recommend going gluten-free. You did not hear me say wheat berries or rye berries in that list, but barley does contain gluten. I think the big thing about gluten sensitivity has to do with other things that are in wheat and rye, and mostly wheat, because how much rye is there around? Rye bread, yes, I'm familiar with that. It's mostly wheat. And finally, somebody has written that it may not be the gluten at all, it may be other portions of what is the construction of wheat, and I believe that for a very, very long time. Now, are there people celiac sensitive? Absolutely. But I think those people who think they're celiac sensitive, or celiac allergic, would be just best if they say, like Nancy Reagan, just say no. So I don't recommend wheat or rye for any of my patients. That means no standard breads, no standard pastas, no standard chips, crackers, cakes, cookies, so on and so on. And you may say, well, that's harsh. Look, I did not write the biologic rules. Play the game by the rules or risk getting arrested, put in jail, hurt, to surgery, or so on. And I've got a feeling I'm coming across a little bit rough today. I think I'm trying to squeeze 2 hours worth of program into 30 minutes, but maybe I didn't wake up on the right side, maybe I'm tired, maybe I'm something or other. You'll let me know. Anyhow, going on, how bad medical studies can be. I recently wrote what I thought was a rather profound, I'm a big blogger. I comment on the medical blogs, I do a ton of stuff on Facebook, and I commented about a study from the Proceedings of the Royal Society of Medicine by A.B. Hill in 1965, where he pointed out the kinds of errors that are made in medical studies. And that is exactly what Stuart Pocock does in this article from the New England Journal that is entitled, "The Primary Outcome Fails, What Next?" And that was just a takeoff point. It was a comment on another article in the journal, but you see, it gets down to judgment. And judgment is the best part of medicine. It's also the worst part of medicine. Cardiac MRI, use it or lose it. There's this woman by the name of Vivian Lee, a female physician, New York University and down the street in New York City. And she wrote this wonderful article on the use of cardiac MRI and techniques how to just use an MRI to find out if you have hardening of the arteries. And you may say, why do you, me, keep talking about hardening of the arteries? Well, it's sort of like the Willie Sutton story of asked why he robs banks, and his answer was, that's where the money is. When I went into medicine 100 years ago, heart disease was number one. If it had been truly 100 years ago, it would have been infectious diseases. But it's not like I picked it because of the money. I picked it because that's where the major technology and breakthroughs were coming, and it was also what was most prevalent. This was just when coronary care units were being invented, and high blood pressure was just beginning to be treated. And people knew about cholesterol, but they didn't know what to do about it, and so on and so on. So the liver just sort of sits there, the kidneys just sort of sit there, but that heart beats, and it beats in succession like that, and it twists and turns, and it has electricity, and that's why I went into cardiology. I also wasn't technically adroit enough to go into surgery. A world-famous surgeon, Robert Zollinger, was one of my professors. He gave me an A in surgery, and he literally gave me an A in surgery because he liked my personality. And he wanted me to go into surgery because, frankly, I'll just say the truth. He saw I could think, and he saw I had a good sense of humor, and I stood up to him too, which was very rare because he always threw everybody out of the operating room who stood up to him. But he liked me, and he asked me to go into surgery, and I told him I didn't have the technical whatever here. And he said he could teach me that. And the answer is, there's a movie, The Kingdom. It's a great movie if you're an action flick guy. It's about an American building that's blown up by radical Muslims in Saudi Arabia. I think it was filmed in Dubai. But in any case, they have this prince, actor, Saudi prince, who is talking about his 2 hunting falcons that he has. And he says that he thinks it's an inborn talent because one is a good hunter and the other one's not that good of a hunter. And he gets the Americans to agree with him. Well, that's the way it is with surgery too. You really have to have that mechanical skill and so on. And I do not have that mechanical skill. My good friend, the psychiatrist Larry Goldstein, he has mechanical skill. As a matter of fact, he trained partway to be a dentist because he did have that mechanical skill. He repairs his own cars, changes the oil and so on. I suppose I could learn that, but that's neither here nor there. Going on. What else? Cardiac MRI, Vivian Lee. That's just like the CT angiograms with FFR. You can figure out what tissue is alive and what tissue is not getting enough blood flow by looking at the T1 and T2 characteristics, and you do various mathematical subtraction techniques. Remember that name, Vivian Lee, and put it together with MRI. Search Google and you'll find her wonderful article. Now, here's something that I often talk about, 5 minutes. This one is food for the human biology. Well, I've already gone through that. We have an enzyme for digesting carbohydrate in our salivary gland. That's not meat, that's carbohydrate. The translation of carbohydrate is plant-based. So what do we have in our mouth? we are looking for carbohydrate vegetarian food to come in. And then we have the jaw that comes down this way, not the jaw that comes down that way. We can't digest rotten meat. The length of our small bowel ratio of nose to tail, would-be tail distance, is that of an herbivore vegetarian. And when I talk about allowing, or the human body will tolerate animal protein 2 to 3 times a week, that's because I do believe a little flexibility is always necessary. But you may say, why are we eating so much fish and chicken and meat? And why do the restaurant, it tastes better. It honestly tastes better. But that's the same story with heroin and cocaine and pizza and ice cream, the things that generate the heart disease, the diabetes, and the cancer. That's the same thing with cigarettes. That's the same thing with alcohol. That's the same thing with not exercising. Doing the right thing is not easy, but it is definitely a case of what I call biophysics. Do it right and it turns out right. Do it wrong and it's going to turn out wrong. And why do you think we're spending something like, how much do we spend on health care? 17% of our gross domestic product, several trillion, not billion, trillion dollars that we literally would not have to. All that money could stay in your pocket. It could reduce your taxes. By the way, is somebody going to do something about the state of Connecticut and the high taxes in West Hartford? Every one of my patients is complaining to me about how expensive it is to live in this state. Yes, I know we have natural beauty and we have this and we have that, but it must be being administered so thoughtlessly. And you may say, well, aren't you going to pay your teachers and policemen and firemen? Hey, I'm not looking at the budget. I'm not an economics expert, even though I act like it sometimes, to the chagrin of my older son. But anyhow, Connecticut is losing population. And all my patients who live in Hartford, West Hartford, are complaining about the high cost of taxation and so on. So my advice is speak up. It's not just a question of this is the time of the year for the elections. It's the fact that we had better take care of ourselves. We have 2 minutes. So that's what I've been talking about. Breathing correctly, drinking correctly, so on and so on. All right, what's right for our human biology? And there's that and that. Oh, why we do what we do. Okay. This was something I wrote. That was published on Facebook. Here's an article about how the DASH diet, which is diet against something, hypertension, lowers uric acid. Uric acid can be lowered to 5.5 or less naturally by being thin enough and limiting animal protein. That's how to lower uric acid naturally. Do you want to do it naturally, or do you want to take your febuxostat or allopurinol? And my point is, you can get away without having to take medications if you do what you're supposed to. Let's see, what is this? Medical economics, 1 minute. Okay, this one is about physician burnout. And I wrote and posted on Facebook, if physicians experience burnout, it should be a very rare event. If it occurs, then they need decision-making counseling, including cognitive behavioral therapy, a friend, and a dose of maturity. Medicine is a demanding profession. Truthfully, stay in reality and deal with the problems in front of you. Bad things happen, accept and deal with them. I guess this is good advice in general. Too much sympathy will only compound the problem in the future. And I think that's where we are as a culture. Good day and God bless you all. H. Robert Silverstein, MD, for the Preventive Medicine Center.